Welcome back. I'm Mabel John. You're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. And in our studio right now is Dr. Skip Trump, who is Chief Executive Officer at the Inova Schar Cancer Institute. Welcome, Dr. Trump.
Nice to be here. Thank you.
Good to see you. Well, this morning during our opening session, we saw that IBM has partnered with the American Cancer Society to provide more cancer information through their technology platforms. You're involved in cancer research. Are you encouraged that there seem to be more stakeholders in this area trying to bring more resources to this type of research and information building?
Oh, very much so. There's never been a more exciting time in cancer biology, cancer genomics and genetics, and it's terrific to see more people recognizing that and directing resources at integrating the science that we're developing in cancer with the ability to deliver better cancer care. So it's a terrifically exciting time.
Absolutely. Where are we in cancer research? What's the latest on what we know about the disease and how to treat it, how to attack it?
Well, I think there are two important considerations. One is that I think we're getting increasingly smart about the importance of the way we deliver cancer care, that the idea of interdisciplinary care where teams of experts looking at the cancer problem from slightly different perspectives all work together to develop a personalized plan of care for each patient. And then, as I mentioned earlier, the science of cancer, understanding cancer, is exploding. So we now know many of the genetic and protein-based drivers of cancer, things that start cancer, cause it to spread. We're learning how to not only antagonize those things that start cancer and drive it, but also enhance the immune system to counteract a growing cancer by strengthening the body's own defenses. So cancer turns out to be probably hundreds of different diseases, but we are getting much, much smarter in understanding them and making enormous progress.
How does all of this information address payment models on how to pay for the treatments that may be available for specific types of cancer or the beginnings of the disease and different stages that we know about?
Well, payment is a complicated issue, but I think what we're learning is that the ability to personalize treatment by understanding the unique characteristics of an individual and that individual's cancer allows us often to deliver specific therapy that is increasingly more likely to be effective and avoid futile therapy. So I think we will see better outcomes. It does come at a cost. Some of the most exciting new medicines have been very expensive to develop, but I think we're getting much, much better with each passing year in figuring out the right person to get the right treatment at the right time.
Certainly, as you say, a very exciting time. What are you most enthusiastic about in this area?
Well, I'm very excited to be the CEO of the Inova Schar Cancer Institute and to develop a cancer institute committed to personalized health and personalized care in a very successful community hospital system so that we can transform the way cancer care is done in Northern Virginia, bringing that interdisciplinary model to care, and also to integrate an enormously powerful platform of genomics and personalized medicine into the care of cancer patients. So we have an opportunity to take what's very exciting nationally and apply it in our community, and I think transform the way cancer patients are cared for.
And what is your advice to people starting out in this area? What do they have to look forward to, or what should they be prepared for?
Well, I presume you mean patients or patients' families, or?
Why don't we do patients' families, and also what about new medical students who are looking at this
those
area?
are both important populations. As far as patients and their families, there's, again, never been a more exciting time. Now is the time, if you're confronting a cancer diagnosis, to be sure your doctor is seeking all available information. It's always appropriate to ask for a second opinion to be sure you receive that interdisciplinary care, specialists looking at your problem from several slightly different angles. And then as far as the upcoming cancer researchers and cancer care providers, it's terrifically exciting. This is a wonderful area, tremendous progress being made. I made a judgment several years ago when I went into cancer that there would be transformation in my career. That was clearly an appropriate and correct judgment, and I think the transformations are going to be even more remarkable in the next 20 years. So this is a terrific time to choose cancer care and cancer research as your discipline.
And finally, it's great to see you here at this meeting. Why do you put this particular conference on your calendar?
Well, it's a wonderful conference bringing together experts from many disciplines, comparing notes, trying to learn from each other so that we can deliver better care each passing year.
All right, Dr. Trump, it's great to see you. Thank you.
Oh, thank you very much. Nice to be here.
And I'm Mabel Jong. Thanks for joining us. Stay tuned for more content.